Dr. Aleesha Sheikh, and I am a second-year internal medicine resident at Mount Sinai Hospital in New York City. And I am so honored that Dharika asked me to speak on this topic for the SDNB VC Doctor's Day function. So thank you so much for inviting me. So the first question I was asked to answer is what made me decide to be a doctor? This is actually a really hard question to answer because I was very young when I decided that this is what I wanted to do. I think part of it was that my grandmother was a nurse and I spent a lot of time with her, and that just kind of became the normal that I was used to, was to see people coming into the hospital with problems and leaving the hospital being with their problems fixed. And the more that I did research and the more that I shadowed doctors, the more that I knew that this is what I wanted to do, that this is the way that I wanted to help people, help people lead healthier lives and spend more time with their families. And I'm really lucky that I've been able to make that happen. So my very first patient that I remember from residency was actually not a patient that I saw in person. It was my very first day of residency, and we were asked to call back patients who had called the clinic asking questions. And this particular patient wanted to know more about the side effects of one of the medications that she was taking. And I remember being very nervous and wondering if I would tell her anything incorrect. I did a lot of research before I called her, even about, very simple things. So I called her back and I spent a lot of time explaining everything to her as best I could. And I didn't think that I had done anything, remarkable. If anything, I was, more nervous than anything at all. But she, at the very end, I remember very clearly that she was so grateful. She said that she was so excited that I was going to be her doctor for the next 3 years, and that I had made her so comfortable by, even trying to answer all of her questions, and that she really appreciated that I had spent that time talking to her. And that's, I think, one of the lessons that I've kept with me throughout residency, is that it's okay to not have all of the answers. What's more important is that you spend the time with your patients and really get to know them and make them comfortable, because that can make all of the difference in the world. Which of my patients' recovery was my best recovery? So I think there's lots of patients that are very meaningful to me, but I think especially in the past couple months with the coronavirus, those, given everything that we know about how deadly this virus is and how many countless deaths that I have seen myself in my hospital, the people that have recovered from COVID-19 in my care are, some of the most memorable that I have, just because of everything they had to go through to be able to survive. So the one patient that really stands out to me is this young man who worked as a grocery store worker. So he was going to work even during the pandemic, when everyone else was staying home, so that those people could get the food that they needed, the supplies that they needed, and continue to stay safe while he was putting his life at risk for everyone else. So that was a really, touching story to me. And I was we were all very worried about him, because for 2 weeks we were unable to help him get off the extra oxygen that he was on, even though we were giving him all of the treatments that we had. But I spoke with him every single day. I spoke with his wife every day, who was very worried about him, especially because she couldn't come into the hospital because visitors weren't allowed. And, finally at the end of, after 2.5 weeks or so, something just clicked, and we were finally able to, his immune system was finally able to help fight off the infection, and we were able to get him home. So that was a really bright spot in the pandemic for all of us, especially after having so many patients who didn't do so well, and hearing the stories from all around the city, the country, the world about how crazy things have been. And being in New York City, obviously it was particularly bad. So that, stories like that and having positive patient experiences like that really help keep us going. Other than COVID, other stressful times that I've had, obviously during residency, there's so many, but I think patient stories are always the most powerful. So one of the things that I still struggle with, even though I had to do a lot of it during COVID, is having to break bad news to patients. I'm a very emotional person, and it's hard for me to see other people suffering. I think most of us would say the same. The one particular case that stands out to me is a young woman that I had. She was only 41 years old, and had 4 children, the youngest of whom was only 2 or 3 years old. And she came with some abdominal pain, some belly pain, and we did a CT scan of her belly and found that her breast cancer had come back and had spread to her liver. And she didn't know any of this. She thought her breast cancer had been cured many years ago, and she'd had surgery for it and thought that everything was fine. And over the course of the few days that, she was with us, and while we were waiting for the biopsy results to come back, I really got to know her family too. And I think having that personal connection also made it really hard for me to break the bad news to her that, that her cancer had come back. And honestly, it doesn't ever get easier. But that was, one of the, and I think it'll always be, those situations will always be some of the most stressful that you face. And on that note, convincing patients who are in a critical stage to stay positive, I think that's really, really hard for anyone to do when you haven't been through the same thing that they have been through. But showing them, in this case, what I did was I told her that I would be there for her and with her through every stage of the cancer treatment process. And so when she left the hospital, when she was getting ready to leave the hospital, I told her that I would be her primary care doctor. Even though she didn't have insurance, I said that I would see her in clinic, and that she was welcome to bring her family to our visits. And even though she had a separate cancer doctor, she had someone else who was managing her cancer treatment, I told her that I would be there to help answer any questions that she had, connect the dots, anything that she didn't understand. I would be there for her. And even if she didn't have questions, just a way for us to check in and see if there was anything I could do, or for her to just vent and talk. And I'd seen her a couple times after she left the hospital. And I obviously wasn't able to see her as much during COVID, but she told me, and her family told me when she brought her kids with her to our appointments, and everyone was so grateful at having the opportunity to just have some more time with a doctor who really cared about her and about her family and about, her prognosis and how she was going to do. And to just know that she wasn't alone through all of this, I think really makes a difference. And so I think for any patient who's in that situation, the best thing you can do is show them that they're not alone, and to just listen to their fears and be there for them.